Hi there, this is Dr. Habib. I'm going to go over a case study of ours of a patient who was suffering from diarrhea, stress, and erectile dysfunction. A short disclaimer before we get started. This case study is not intended to treat or diagnose. This information is provided by the Living Proof Institute and is not intended to replace the medical advice of your doctor or healthcare provider. Please consult your healthcare provider for advice about a specific medical condition. So Dan came into our office. He's 48 years old. He's a husband and father of two. He works as a courier for a shipping company. He was dealing with on and off bouts of diarrhea for 3 years. The most recent bout was occurring daily for the past 4 months. He also had significant difficulty maintaining an erection. Our clinical presentation showed that blood work showed that everything was quote-unquote fine. Nothing was outside of the normal ranges. Everything was in the normal range, according to his family doctors. His family history showed a history of prostate cancer and colon cancer, as well as autoimmune conditions. And he was dealing with constant abdominal pain, gas, and changes in his bowels, leading to diarrhea. Dan wanted to address the following when he came into LPI. He wanted to address his upset stomach and diarrhea, his stress levels, and his erectile dysfunction. He had previously seen his family doctor, and his family doctor diagnosed him with irritable bowel syndrome. He was prescribed Constella for the irritable bowel syndrome and Cialis for erectile dysfunction. He had seen a gastroenterologist who did not give him any explanation as to why this was happening, why the irritable bowel syndrome was occurring in the first place. He had gone through 2 colonoscopies with no answers found. He was obviously very frustrated at this point. During our intake session, we noticed that Dan had increased symptoms when he ate certain foods, especially those containing dairy and wheat. We noted a link between the IBS and the erectile dysfunction in his timeline as to when they both started. They were linked together in their timeline. Dan was not exercising at all, and in his intake form, he did state that he was not happy with how things were going in his life. We suggested some functional lab testing, and on a stool test, we noted the following. He had a high level of good normal E. coli bacteria. We can have too much of a good thing, and that's what was happening in his case, in Dan's case. So the E. coli levels were high. And when we see that, we often have to wonder if the E. coli has gotten into the small intestine, as our normal bacterial flora should only live in our large intestine. We also noted that he had positive findings for 2 parasites, both Blastocystis hominis and Dientomoeba fragilis. These parasites were stealing nutrients away from Dan, not allowing him to create the hormones that he needed, and this could be leading down towards his erectile dysfunction. We also noted that his antigliadin Sig-A, which reacts to gluten. Gliadin is the protein component of gluten. He was actually very sensitive to gluten. His finding was 33.3, and it should have been below 6.4. So there was a clear dietary component to Dan's issues here. We then did a breath test to determine where exactly the bacteria was, if there was bacteria even present in the small intestine. And very clearly, there was a lot of bacteria present in his small intestine. Normally, we should see at baseline, the number of parts per million of hydrogen and methane should be below 20, and he started at 62. That number then bounced around a little bit, went up and down, but reached its max at 90 minutes. It came up to 88 parts per million of both hydrogen and methane gas. In his case, in fact, most of the gas was methane specific. So we know that the bacteria that had gotten into his small intestine was producing a lot of methane gas. It was also producing a lot of toxins, and that's shown as well on his urine test, that there was these bacterial toxins getting into his bloodstream and then being cleared out through the urine. And so we can see that there are 3 findings that are in the red zone and 1 that's on the borderline as well. And these are bacterial toxins that are noted in our urine. So clearly Dan had been getting this bacterial toxin into his bloodstream and into his urine, and that was affecting him as well in terms of his hormones. So what we did with Dan was we started with some lifestyle changes, dietary first. We could put him on a gluten-free and dairy-free diet. In fact, he went on a full paleo diet. He started a daily meditation practice to help deal with the stress of his daily life. And he began exercising daily with light weight training, specifically because we wanted to boost his testosterone levels. In terms of supplementation, we started with some antimicrobial support. We supported his energy production, which needed just a little bit of help, and probiotics to help get the gut bugs back to normal. We wanted a good bacterial flora in Dan's gut. And what happened with Dan? Well, Dan noted the following changes after 5 months. He completely eliminated his diarrhea, had no more bouts of IBS. In fact, he was going twice a day very, very comfortably. He was permanently off of Constella, his IBS medication, with his MD's approval. His family doctor approved this and helped him to back off the Constella. He was able to actually lose some weight. He lost about 15 pounds, which likely was attributed to the exercise program and his dietary changes as well. His mood and his outlook significantly improved. I remember he came in the last day and he just had a big smile on his face. He was very, very happy, and it seemed as though he had turned his life around because we had fixed the health issues and he had worked to make those changes positive. And he no longer needed Cialis at all. You can imagine that made him very happy. And he made necessary changes to his employment to help improve his social life and his daily enjoyment. A lot of his stress was coming from work, and he was able to make the changes necessary to improve his daily mood and outlook. So if you are dealing with anything like this, then there are some next steps for you to go through. First off, you can join our Facebook group at www.lpicommunity.com. You can register for our free 30-day program, www.30in30.org. And you can become a living proof patient and go through a free phone consultation by going to www.improof.com. Thank you very much. I hope this has been very informative to you.